that's one thing people don't probably realize, is that I think YouTube has made me a better doctor because it has pushed me to try to stay on the cutting edge of every little topic I can.
It's interesting though, Joey, with the evolution of artificial intelligence and teleoptometry and just the advancements that will take place in our professional careers. I would imagine that you would be able to almost triage and work with individuals that truly want to talk to Dr. Eye Health, Dr. Joseph Allen, and have a business set up that way. But have you had patients fly to you or come from a, like a regional drive and say, I'm seeing you and I'm seeing you because of this? And what did that look like? Because I know you had to have, right? There has to be people that have made the trip.
Many. So I did recently just move from Minnesota to the state of Virginia. I now practice in Richmond, Virginia. But even when I first started back in 2018, I had my first patient ever came in simply because they saw a video about astigmatism, and she lived an hour away. And she was like, hey, this guy only lives an hour away. I'm going to go make my eye exam up there. I think she used like provision benefits too and bought like, it was nuts. She bought like 7 pairs of glasses.
Oh, wow.
And so my that video paid off just from that one person coming in. But yeah, so we've had people, trickle in once in a while. In the last few years at my previous clinic in Minnesota, I was getting at least one new patient every day that had found me online. Whether they lived in the state of Minnesota and they drove a few hours, or sometimes even a few patients that would fly in from other states, and even some people that flew internationally.
Wow.
Just to either have a comprehensive or a lot of times to do like more of a thorough dry eye examination, or to even have treatment. Probably the craziest one is I had a guy fly from Dubai. He
Wow.
He had
Dubai?
Yeah, so he's like, we don't have dry eye doctors over there. And so he was suffering. He flew to New York, then flew from New York to Minnesota and did a dry eye evaluation. And it was kind of funny because he asked me how much for the LipiFlow. And and I told him, oh, we charge maybe about $1,000 for that procedure. He's like, no, how much for the machine? Like he wanted to buy the machine.
Wow.
In retrospect, I should have just said like $100K or something. But
I could connect you with one of the many manufacturers, but I'm not sure you're going to meet the criteria.
Yeah, so I kind of told him like I don't know if I can sell that, but that was one of the most probably the craziest story I've had. But the tough thing with the people who come in, the vast majority of people have already seen 6 or 7 doctors, and they're frustrated.
Yeah.
Some people do. I think I'm more of a therapist than anything. Like they're really suffering with pain, anxiety, depression, especially in the anterior segment space. We know how connected dry eye, anxiety, and depression are, especially if it's neuropathic, neurotrophic.
Yeah.
And then I think I've only had 1 or 2 patients who came in for a full just exam to see me specifically that only needed just a routine exam. So a lot of people are struggling with things, and just whether they want true answers or they just want somebody that they trust and will listen to them. So usually those days, those VIP patients, I run a little behind because
of course,
I want to do my absolute 100% best all the time, but those patients, the pressure's on a little bit higher.
Well, Joey, you've built this trusted brand online as a trusted authority on eye health and vision education for consumers. And with that comes, a lot of notoriety, but also I'm sure a lot of responsibility and a lot of pressure at times. What are some of the challenges that you may have faced throughout this content creation journey? And we'll get into like you do doctor content. You have your irons in a lot of fires. But what are some of the biggest challenges that you've ran into, and how did you navigate those?
So I'll again thank you for the great questions. I think one of the bigger things is when I do make content, again, whether it's for consumers or for doctors, because I do have videos for doctors either through publishers like BMC or iTube.net or like Modern Optometry, but then CE lectures and things like that. But when I do a video, even if it's on something like a chalazion, I always have to stop and be like, okay, how do I address this? Not only entertainment wise, because you have to have some level of entertainment to really get people to stay watching your video.
Of course.
But how do I teach this that's both like digestible to somebody who has no idea about eyelid anatomy or really how inflammation works, to also have it so that doctors will respect it and agree with it. And at the same time, so I do a lot of research. I read like, okay, is there any publications in the last year or two that of something that I haven't read or haven't understood yet? Maybe I'm behind, from what I learned in school or residency. So I do spend a lot of time reading articles and making sure that I'm in top of my game. So that's one thing people don't probably realize, is that I think YouTube has made me a better doctor because it has pushed me to try to stay on the cutting edge of every little topic I can. So I think that's made me better in a lot of ways. But
a lot of people, Joey, what a lot of people don't know too, but you know it very well, is a video can be watched 24/7, right? You go and you present at a conference, and unless it's videotaped and redistributed, you're only being seen by those eyes in that room. But your content, and you're very aware of this, is out there, and it's out there for everybody to see at any time of day. And you being such a perfectionist, I can tell you're a perfectionist. You may run into analysis paralysis, and so at times that has to stress you out. How do you manage that, man?
Yeah, the honesty is I struggle with it. The analysis paralysis is a real thing. I get in my head pretty easily on all sorts of topics. I think I could have published like 600 more videos at this point if I didn't struggle with that as much. I do think it's important, especially talking about healthcare topics, because nothing drives me more crazy than hearing some doctor of any type, it doesn't even have to be a doctor, but on social media saying something that's just like, that is not correct. That is not in agreement, not even in like I was just like, where are you coming up with that? I'll just mention, I saw a social media post on like TikTok or whatever, from some doctor in the UK saying that, like only 50% of people can use this muscle in their eye. And then it's like, the ciliary body? Really? Like, do you not know how the ciliary body works? Like, where are you coming up with that statistic? Like, what are you talking about? So that gets me really frustrated.
Well, and you have every right to be, because if that video is reaching a certain number of people, how are they going to take that information and move forward, right? Like, nobody's fact checking all the content that's out there.
Yeah.
And so that's got to be frustrating for you, who's doing it the right way, and you're trying to educate people, and others are just trying to maybe make a quick buck or push a product or this or that. And that's where the challenge probably lies, right?
I think there is some in that. Back to your original question about analysis paralysis. Again, I honestly struggle with it. I journal quite a bit. I try hard to check my ego at the door if I can, because it's easy to get motivated by this fear of, like, oh, I need to make money, or, am I trying to make this video to like make it go ultra viral to get attention? It's like, no, I try to really pull it back and be like, what is my mission? Who am I really trying to reach? Who am I trying to help? I almost use my overactive imagination to put myself back into the seat of like a 16-year-old kid who knows nothing about eyes, but I want to know what's going on with my eye. What questions would I have for the doctor? And then I try to like flip that and reverse engineer it. And so I try to like break that down, and also just tell myself, you know what, it's more important for me to get this information, even if it's not absolutely perfect, word for word perfect. It's more important for me to get this out now and be mostly done well than for me to drag it on for 6 months, trying to make it as perfect as possible. So I tried to have those conversations with myself. But I think it is a struggle. I imagine, I don't know, have you ever battled with it or come up with
all
a
the
good
time.
solution?
Yeah, absolutely. And I think that the thing that I come back to is, why am I doing it? The biggest struggle I've had is consistency, and you are incredibly consistent. And it comes down to, I have a wife, I have kids, I have a practice, and prioritization. Um, it can sometimes be a challenge of trying to make sure that the attention is directed to what needs to be priority. And for me, that's faith, family, and then of course my practice. And then, content creation and all that on the side is something I circle back to at times, and I get, winds of energy to get it going. And, but all that being said, it's a unique challenge that I think anybody faces, not only in content creation, but in practice, in clinical practice. There are times where we have to reassess, why are we here? And what is our mission? It's to serve the eye health and vision care of others, whether you have specialization, whether you have, no matter what modality you're in, whether you're an owner or an employee, we're here to help people. And I think that is the greatest point you mentioned even earlier on, is YouTube for healthcare professionals. Content creation for healthcare professionals is just so different than content creation for a lot of other niches. And why is that? Because we have a responsibility to educate the public on their health. And that's just a different playing field, But thank you for sharing that. I want to give you the opportunity, because you don't get this opportunity a lot. What are some of your greatest accomplishments through all of this? Because I see it. I know how hard it is for somebody to get the silver YouTube, and then I don't know the next step. Maybe you got the next one too, but the reality is, and it doesn't have to be like just accolades. It could be stories of like, I'm just so happy that my content or my educational content for consumers or even doctors has led to this.
Well, again, there's so much. I wish I could say thank you again for all of this. Also, I'm happy to hear that you have your values as a person, as a father, as like a family man, as a businessman in your community. It sounds like you have your values prioritized, and you also have reflected on that, and that obviously drives who you are in your place of business and in the profession. So, this makes me happy to hear that you've done that sort of work. The kind of the reflection of things that have really I hold dear in terms of like what has brought success. I really kind of led with the mission of, I wanted to basically lead the platform for public education on eye health. That was like my main dream. It's like, I always want to lead that. And I feel like I did accomplish that. I accomplished that probably years ago. Getting the accolades of, you get a silver play button when you hit 100,000 subscribers. That was mind blowing. We accomplished that in 2020. And then 1 million subscribers, which is a gold play button they send you, came just this January of this last year here in 2024. Wow. And to me, what's kind of nuts about all of that, I think of it as a testimony of how valuable our knowledge, our profession brings. People are curious. People want to know. People value their eyesight. Our knowledge, just sharing the education, is extremely valuable. So you spending even 3 minutes explaining cataracts to somebody in the clinic, honestly, is probably worth more, as much, if not more, of that, whatever you're getting reimbursed by the insurance company, than anything else in your exam. And so, and keep in mind, we have over 1 million subscribers now on the main YouTube channel. That's less than 9% of people who've ever viewed the channel have ever hit the subscribe button.
Wow.
So that's really cool. Certainly the comments, I get personal letters, handwritten letters, and art people will send me from fans who, they're like, hey, I started seeing flashes and floaters. I didn't think it was a big deal. Saw your video, went to see the doctor. Turns out I had like 4 tears. So they thank me for helping them, just raising awareness about flashes and floaters. I had somebody just this doesn't happen very often. I've had 3 or 4 people, just random people on the street, recognize me from YouTube. People not in the eye care business, right? If we go to Academy or something, there's a lot of people who come up and say, hey, they'll say hi and want a picture or something like that, which is always cool. But having just somebody random on the street say they recognize me at an airport, they're like, hey, I've watched your videos on YouTube. I bought these glasses because I saw your video about, like transitions lenses, and they love them. Like, that's amazing. Had a guy tell me he learned how to put contacts in from me. And then I had a student at Academy this last year. He was a third year, came up and told me, my channel is what inspired him to go into optometry to begin with. Like those personal little moments are really the moments where I felt like, wow, this is unreal.
Well, in your videos, your consumer videos are going to be something that is out there. And as YouTube continues to grow, it's hard to think it's going to grow, but it will continue to grow because it's a massive platform and it already seems so overwhelming. But the truth of the matter is it's going to grow, and that content and the production quality and the education that you put behind it is incredible. And information is dynamic. So I know you're going to keep coming out with the latest and greatest on that, at what you feel at your core heart makes sense. I'll be honest, and I think that a lot of our listeners should consider this. We utilize your video for INR. I created one myself, but I also have it in there. And I also have it for hard, specialty contact lenses because the content is so good. It's so easily digestible by our patients. Why recreate the wheel? Why not embed it into a website page and have patients utilize it? You have so many good educational pieces of information in content and YouTube content and video format that I think that our profession should really tap into that. That's an outstanding thing for us to use as a resource. Now, what you didn't mention is you've also been really well recognized in the world as an optometrist. The AOA had recognized you. I don't remember the name of the award, but I think you got the inaugural award, which I think is incredible. What is this transition into doctor education? What does that look like for you? Because it's being recognized. You're doing a ton. You have the I Give a Damn podcast through Florisy Media. But tell me a little bit about that. What has that been like?
So it's always been in my kind of my same mission, because I realize also, I think a lot of professors and a lot of other educators and mentors feel this, that we can go directly to our patients. We can serve 20, 30 patients in the clinic with really amazing eye care. But, if I can teach another doctor, if I can mentor somebody, then that has it echoes waves that pass down to more patients and more patients. So it's really kind of drives that mission of wanting to help more people. So I did start, I basically worked with Florisy Media to start the I Give a Damn podcast, which is kind of like even your podcast, Ryan. It's trying to share the stories, share insights from leaders, entrepreneurs, and other just experts in the field of eye care, kind of having more in-depth behind-the-scenes conversations, the things that people really give a damn, what motivates them about eye care and optometry. I do have videos on called Eye Care Insiders, which is over on iTube.net, which is very similar to YouTube, but it's talking to doctors about, hey, this new medication just got FDA approved. What do the clinical trials really say? What are the side effects? How do you even prescribe it? And breaking that down into like 10 minutes. And again, pushes me to stay on top of my game. It's like, I'm going to be doing this research anyway because this medication's coming out. Let me see if I can crunch it into a 10-minute video so doctors can just learn quickly rather than them having to spend 4 hours reading everything like I am. And then now, funny enough, I'm actually kind of going international and giving lectures to other professionals outside of optometry, neurologists. I've been invited to a couple of different conferences and trying to teach not just like eye care topics, but teaching like education, how to better communicate, or how to even be on social media to other healthcare professionals. Because I think there is this, in my head, I see this battle. It's like Lord of the Rings versus like the orcs sort of thing. Like of like true medical knowledge versus just misinformation and like people trying to sell BS. Like,
Ah,
right there's this, we're in this really kind of scary world where, especially using AI, like deep fakes is a thing that is happening and is going to get even worse.
oh
And
yeah.
it's going to be really hard to tell what's real, what's fake, who to trust. So it's, I don't know, that's how I picture it. So I'm trying to help share my knowledge of social media so that other doctors can, if they want to join me, or at least if they want to know how to better educate their community in some way, then I can help with that.
Well, that's incredible, and I can advocate for just what I've seen. I mean, you're impacting millions of lives through YouTube. You're impacting millions of lives through educating doctors. You're kind of hitting it from both angles. If somebody were to embark on a journey, and it doesn't have to be obviously directly the journey you've taken, but let's just say that they want to have a greater impact in optometry and they want to use media, video, picture, audio, what would you recommend? Like, what if you could give them just one or two pieces of advice? What would it be?
So number one, of course, video is kind of king and has been for many years. If you can, like, I think you know this, Ryan, but it's finding how you can best utilize your time. And I do think that's why like podcasts, and specifically video podcasts like this, have risen in the last 3-4 years, because you're basically allowed to multi-purpose content.
Mm-hmm.
That's why funny if people know Joe Rogan as being one of the most famous podcasters. Most of his success and his rise to fame did not come from just his 3-hour long podcast episodes. They came because they took his 3-hour long podcast episodes and spliced them into small 3 to 4 minute segments and posted those online on like places like YouTube and Instagram. And those little clips went super viral and got more attention. People got more introduced to his brand. And so that led people to say, oh, I'm going to actually go listen to his 3-hour long episode. And so you can do that with a video podcast. And I think there's a lot of moving parts, but if I was going to start over from fresh, I would probably start inviting experts or other people in the field of eye care or other fields in healthcare onto a video podcast. I would splice it up. I would have the podcast living on its own, both long form and a video, and the audio form and all the different podcast websites. I would use AI tools to splice it up into small segments. I would scatter that on every platform I can, with the intention of picking one platform to hyper focus on. Because
Mm-hmm.
every platform, whether it be Instagram, whether it be YouTube, whether it be LinkedIn, whether it be TikTok, each platform runs so differently. You need to spend the time to really learn how that platform works and how to utilize it the best. Once
Yeah.
you've once you've mastered that platform, then you can sort of like move on to mastering the next one. And so I say that, but at the same time, I'm also like, I recognize that even one platform is a lot, and the target is always a little bit moving because the
Mm-hmm.
algorithm shifts, the everything changes. And so I'm right now myself, I feel like I've just barely mastered YouTube, and now I'm kind of looking, okay, what can I do with LinkedIn? What can I do with Instagram? Um, those are the next two platforms I'm really interested in utilizing.
Well, and you've had the courage just to press play and get the ball rolling, and don't be worried about the mistakes that will happen, or like your camera dies in the middle of a video, you don't realize it, or the lighting goes out, or your garage door. Like, I mean, there's so many things that can happen,
Yeah.
and just understanding we're human, and the product that you put out there is incredibly high level, great audio, great visuals, great everything. It takes time, and you just have to get started, right? And I think that as you referenced, a long form video podcast and spliced up. And that's kind of what I'm hoping to do with this as well, honestly, just to get my foot back into it. But there's just so much to it. Right. And so I appreciate you sharing that. You did mention to me something before the podcast about just, taking a moment to pause and reset. And you made a decision recently. If you're open to sharing, I'd love for you just to kind of share just your thought process behind that decision and how it's going to empower you in the future, like the next, 1 to 2 years.
So it's interesting because we were talking about like, what is like the number one tip, I think, for people to find success in, especially in building social media or building anything in this world, is showing up and being consistent. And that's something I've tried really hard to do. And I think most of my success on things like YouTube has been because I tried to show up every single week with a video. And there's times I had to take a week off or something like that. But it's been almost 7 years and I've been running this marathon consistently.
Wow.
Posting like a video every week or a live stream or something. Imagine if you decided I'm going to do a CE lecture every week for 7 years. That's kind of what it feels like. And just recently, I made the executive decision for my business and for the YouTube channel even to not post for at least 3 weeks, which is tough because you can imagine with any business owner, if you run a clinic, it's like, I'm going to choose to take 3 weeks off a clinic and shut the doors. It's scary. Like you have this voice in your head telling you shouldn't do this. Like you're going to lose all this potential income. The world, the sky's going to fall. The world's going to end. But for me, it's not that I'm taking weeks off to go on vacation. It's so that I can take a step back and retool the business. It's like if you said, hey, I have to close the doors because we have to do a remodel. We have to remodel the clinic because everything looks like it's from the 1970s. We need to have it freshen up. That's what I'm doing right now with the YouTube channel. It's been 7 years and I'm exhausted, but I feel like the game has changed and the mission has been accomplished. We need to kind of shift. I also want to get off of the hamster wheel of me. Okay, I have to come up with a video next week. What's the topic? Okay, let me do the research. Okay, I'm only got a few hours to do this. Let me set up the camera. Let me shoot. I've been running on like my adrenal glands every single week to pump something out. It's like being back in college and being like, crap, I have a paper, like a 7-page paper due tomorrow. I haven't started. It's 7 o'clock at night. That's how my life has been running for a long time. And if you've ever read motivational books or business books, one of them is called 10X is better than 2X, that sort of concept. In order for us to get where I want this business to be, where I'm like a month or two of videos done in the bag, ready to go out, where I have bandwidth to work on other projects, other lectures, to build products, to better help people, to do more consulting, I need time. I need to buy myself time. And so my assistant and I have decided we're taking several weeks. We are putting that time, instead of making content, to building systems and strategies, figuring out who we need to hire, what tasks they're going to be doing, and getting those engines running so that when we start in 2025, we don't have just me running a hobby of making the next video, make the next video. It is a full-blown business with an engine that's running even when I'm giving a CE lecture somewhere else, even when I'm doing something or sick, that's really the gear shift. But it takes, there's a mental battle when you have these voices in your head saying like, oh no, yeah, the world's going to fall apart because you're going to not post anything for a few weeks.
Well, guess what? I admire you for doing that, because what you've done to be this consistent over 7 years is nothing short of incredible. And I know you're going to come out of this more recharged. You're gonna have a renewed source of energy and more clarity and focus for what you want to do with your time and your business. And I know anybody who consumes your content and tunes in and is a huge fan of you is going to appreciate it, and they'll understand. And guess what? The sky will not fall. The world will not end. You are a very impressive individual, Joey, and I appreciate you being on the podcast. Where is your favorite place for people to contact you? Because you are inundated with so many messages. I wouldn't recommend an optometrist to make a comment on your YouTube video because you might not see it. So what's the best way for them to get into contact with you where you can have that clarity to follow up?
Well, actually, funny enough, I would love if optometrists would comment on the videos or answer people's comments along with me.
There you go.
I've had, thankfully, some retina surgeons on my live streams in the comments answering questions people have about injections of like AMD, and that blew my mind. I'm like, yes, let's like work as a team here. This is great. But if somebody does have questions for me, they want to reach out, email me at drihealth@gmail.com. You'll probably get a kickback message just saying, hey, we got your message. Just give us some time. We do get a lot of emails, but I try my best to certainly prioritize and spend some minutes getting back to doctors and people who are reaching out. So yeah, happy to help anyone out if they have questions or something they want to work on.
Well, you're truly inspirational, and you've been a huge advocate and resource for our profession. Thank you for being on the podcast, Joey. And I look forward to touching base to learn more about what this time off stretch looks like. I could definitely have you back on and we could dive into other topics. There's so much we didn't discuss today, but that's it for today. If you haven't liked or subscribed, definitely do so. Share this out amongst your peers, and and any feedback, leave it in the comments. That wraps up my 2-part discussion with Dr. Joseph Allen. Thank you for listening, and stay tuned for my next podcast where we can reflect and grow stronger together.